Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Monday, June 22nd, 2020. Joining us today, Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory.
Well, good afternoon and thank you, Brad. Today is a good news day for Toronto and the many businesses who have been patiently waiting to open their doors again. As the province announced earlier, Toronto is able to move into Stage 2 of the reopening this Wednesday. I do not believe it is a moment too soon from a public health standpoint, but it also can't come a moment too soon for people and for businesses in the City of Toronto. The City of Toronto is ready to oversee the safe restart of some services and the partial reopening of many businesses following this provincial announcement. I want to thank Premier Ford for the collaborative, regionally sensitive way in which this matter has been dealt with to date. And I want to thank our Medical Officer of Health as well, who's represented us well and responsibly, as you would expect, in the course of all of those discussions. The progress we are seeing in stopping the spread of COVID-19 in our community has led us to this moment. Every Toronto resident and business who have done the right thing over the last 3 months by following public health advice, all of those people have helped us get to this moment. I want to thank all of our frontline workers as well who've been focused on fighting this pandemic, because they too have helped us to get to this moment. Their efforts have saved thousands of lives and have helped us get to the point where we can proceed to this next stage. And that's all it is. It's the next stage in what is a continuing fight against COVID-19. So starting Wednesday, and subject to complying with the Toronto Public Health and provincial public health guidelines, restaurants and bars can reopen their existing patios. Malls can reopen. Barbershops, hairstyling, nail salons, tattoos, and aesthetic services can open and provide most of their services. And it also means that we can proceed with the Swim-TO plan to open our splash pads, wading pools, indoor and outdoor swimming pools. So splash pads will start to be up and running as early as Wednesday, with 15 outdoor pools set to start opening on Friday and others to follow on Saturday. Wading pools will begin to open on July the 1st. We are ready for Stage 2. I'm confident that if this reopening goes well and if people continue to follow public health guidelines, because they're still there when it comes to physical distancing and personal hygiene and face coverings, we will keep making good progress and we will move safely, but hopefully quickly, into Stage 3. In particular, this will be a desire strongly held by restaurants without patios, and I acknowledge the continuing serious challenge facing them even after today's news. I also encourage everyone never to forget that COVID-19 is still a threat in our community, and please to continue to take every precaution you can, including wearing a face covering when you go inside a store or ride the TTC, and please continue to wash your hands frequently and practice other hygiene that we've got used to doing in the last months. The announcement of Toronto moving into Stage 2 is a great day for our city, and I know the coming days will be even better for individual residents, for employees, and business people across the city. Today, I also convened another meeting of the Greater Toronto and Hamilton area mayors and chairs of the biggest cities in this region. The GTA municipalities have been on the front lines of responding to the COVID-19 pandemic and are ready to support the successful restart and reopening of the economy. In fact, some of them were already doing so, with Peel and Toronto joining that list today with the announcement and, of course, the reopening beginning on Wednesday. As the remaining GTA municipalities, including Toronto, move to Stage 2 this week, we will all be focused on supporting more businesses to open safely and successfully, and the opening of more municipal services that we know our residents need. We trust as we move forward into Stage 2 together and on to future stages that the province will continue to work closely, as they have been doing, with the local medical officers of health, including the Medical Officer of Health for Toronto, and that they will continue to demonstrate sensitivity to possibly differing regional realities. The increased demand on municipalities and our services that will come with Stage 2 comes while we are still experiencing unprecedented costs responding to COVID-19 and significant revenue losses due to the continuing pandemic. We understand discussions continue to be underway between the federal government and the provincial government to come to an agreement to meaningfully address the financial challenge municipalities are facing. We support this process, but we hope it is resolved with a positive outcome as quickly as possible. The sooner this financial challenge can be resolved, the better for all of our residents and all of the services municipalities provide, and that must be provided in order to ensure a strong recovery. Beginning as early as this week, municipalities in the GTA will begin making budgetary decisions for the remainder of 2020 and for 2021, next year. With final property tax bills for 2020 already sent out, that leaves the prospect of in-year service cuts starting as early as next week as a very real possibility if assistance is not forthcoming quickly. At least those cuts will have to start being discussed. Today, the mayors and chairs agreed to step up their advocacy with their local MPs and MPPs. We are committed to supporting them, meaning the MPs and the MPPs, as they advocate on our behalf, the millions of people who live in this region, to make sure that the GTA municipalities, and for that matter cities and towns across Ontario, get the help they need and get it soon. We also began a discussion today between and among the mayors and regional chairs of the region involving recent tragedies which affected people in personal crisis, in some instances losing their lives after encounters with law enforcement. These are all tragedies which, no matter what the circumstances, can't be explained away, since help was sought for people in crisis who ended up losing their lives. A system which produces that result cannot be said to be working. That led us to resolve that we will initiate discussions as a group with the province to see if together we can develop a province-wide reform which will change the way in which we deal with people in crisis across Ontario as a part of the mental health system, and as a part of providing support for people with mental illness. As well, all of the mayors and chairs noted the unacceptable length of time which passes during SIU investigations of these tragic events with very little available information. This too cries out for improvement and for reform. Over the weekend, we saw a number of crowds on our beaches. This raised two issues: concerns from the standpoint of health about physical distancing and concerns about litter. These concerns have been raised with my office and Councillor Bradford's office, and we have registered those concerns in turn with the relevant city departments which have acted. We've dispatched more bylaw officers and cleanup crews to try to address this. The Parks, Forestry and Recreation Department has doubled its staffing on the beaches. This is a group already tasked with performing continuous cleanup and utilizing the additional staff. An extra cleanup blitz was launched at 7 o'clock this morning. But the bottom line is that we shouldn't have to double the staff and shouldn't have to have cleanup blitzes simply because some people have decided to have a big beach party during a health emergency and leave tons of garbage all over the beach when they left. While we want people to enjoy our beaches, we really want people to enjoy our beaches during this all too short summer that we experience in our city, the beach parties themselves are not consistent with applicable and necessary health orders. I know they're happening in part because other places to go aren't open, and this Wednesday's reopening should help with that. Going above and beyond, as so many have already done up until now, we need people to show respect for the health of others and for the beauty of our natural spaces, including our beaches, by limiting their visits for a while yet, and by deciding that degrading the beaches with litter is just not on. Given the number and the length of our beaches, enforcement is very challenging. So we have to count on one more time for Torontonians to come to our assistance and to band together to do the right thing, and that is to keep the beaches safe and healthy and clean by accepting a degree of personal responsibility and by trying to do the right thing, which means respecting the health advice that has been in place for so long now. And so on that note, I will ask Dr. de Villa if she will offer her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 37 new COVID-19 infections in Toronto. We are making good progress in reducing the spread of COVID-19 in our city, and I'm pleased to see a steady decline in our local cases. To date, 11,879 people have recovered, an increase of 62 since yesterday. As always, for more data on the status of COVID-19 cases in our city, I encourage you to visit our website. As Premier Ford announced earlier today, this Wednesday, Toronto will join the rest of the province in Stage 2 of reopening. This is the result of your continued efforts to drive down our local COVID-19 cases. Your actions are helping us to move forward, and as a result, some of our local businesses will soon reopen for modified services with appropriate public health measures in place. While this is good news, I also understand that this transition may bring some people concern about the ongoing risk of infection and illness. We are still learning new ways of socializing and interacting safely in our new reality as we live with COVID-19. So what does moving to Stage 2 mean for us? Well, it means that with certain modifications to reduce the chance of virus spread, a number of different businesses and services can reopen as they are ready. This includes outdoor patio dining services at restaurants and bars, recreational water services, including splash pads, wading pools, and outdoor swimming pools, personal services settings, including hair and nail salons and tattoo parlors, shopping malls, and weddings and funerals, with limits on indoor settings of 30% capacity and outdoor settings of up to 50 people. I would ask that you please visit our website for a complete list of businesses, spaces, and activities that can resume and the modifications they need in order to reopen. I'm confident that we can enter Stage 2 with ongoing care. It is your actions that have allowed us to transition to this new stage. You can see from our monitoring dashboard that new cases, hospitalizations, and outbreaks all continue to decrease, and that these indicators have met the goals we set out for a safe reopening. Our health system continues to be available. We are on target with contacting cases and conducting their follow-up. Testing volume is up, and the percentage of tests that are positive is down. We will continue to monitor our dashboard to ensure that our key indicators stay in the green as we progress through to the next stage. We also need to keep watching and learning from our own experiences and from other places that have experienced COVID-19 outbreaks earlier than us. We will need to be watching very carefully for any flare-ups of new cases. Around the world, we are finding the balance between protecting our health and reopening many of the businesses and activities that are important to all of us. We still need to be thoughtful and cautious to keep everyone safe. The reality is that COVID-19 remains in our community, and we need to learn to live with it while a vaccine and treatments are developed. We are making good progress in reducing the spread of COVID-19 in our community. Please remember that our continued progress rests on you and your actions to keep us going forward. We all have to do our part. This means staying home if you're sick, maintaining a physical distance of 6 feet from others outside of your social circle, wearing a cloth mask, especially when you are in indoor public spaces, and washing your hands often. This will continue to be our new reality as we live with COVID-19. As I shared last week, as more people are connecting, mixing, and moving around in our city, I'm asking you to keep track of where you are when you are outside your home. Whether it's by using a mobile app like the one announced by the provincial and federal governments last week, or keeping a log of where you've been by taking photos with your phone with your location settings on, or by recording your activities in a daily calendar or a log, I just ask that you please take note. Should you be diagnosed with COVID-19, this information will help public health to quickly identify your close contacts and help us work together to stop virus spread and to keep our city safe. Thank you to everyone who has worked so hard to get us to this point. While we are not completely out of the woods yet, we have come a long way, and we have done this together. For this reason, I ask you to please consider others, and please keep following our public health advice. Please continue to keep your distance from others outside of your social circle. Keep washing your hands. Keep wearing your cloth mask to protect others from your germs. And please continue to take care of each other. I'll now hand it back to Brad.
Thank you, Dr. de Villa. Staff on the line to answer any questions reporters have include Mary Ann Bedard from Shelter Support and Housing, Paul Raftis from Senior Services and Long-Term Care, and Janie Romoth from Parks, Forestry and Recreation. First question is to Mark McAllister from City News. Go ahead, Mark.
Well, I guess the big question at this point becomes, how do we maintain this and how do we make sure that we stay at this level? What is the advice that you offer Torontonians to make sure that we don't get too relaxed? The question could be for either of you.
I take it that question is for me, Mark. I would suggest that it is exactly following that advice. If we take a look at what's happening in other parts of the world, we need to continue to pay attention to the experiences and recognize that as more of us are out and about and moving around, that there is that chance of increased interaction, and that does give rise to risk of virus spread, risk of virus transmission. So I would just emphasize again, please stay home if you're sick, wash your hands, maintain that physical distance, particularly with those outside of your social circle, and when you are in an indoor public space, please use a cloth mask. As I've said in my remarks, we are not completely out of the woods yet. We need to continue this vigilance, and we have shown that we can do it. I trust that Torontonians can continue to keep up the good work because we all want to get our city back, to continue to move forward in our journey and move forward with reopening our city.
And Dr. de Villa made reference to indoor spaces. May I just make a reference to outdoor space, because we had a bit of a discussion about this earlier on today, and one of the people on our command center call today said, I'm paraphrasing, that when the drinks go down, the sort of activity level goes up. And we've seen elsewhere where there's been an opening, including in the United States, that sometimes as the drinks go down, and we're not against people having a good time and enjoying the summer months, that some of these rules suddenly go out of your head about trying to stay away from other people or keep your distance from other people, even the wearing of a mask, and even sometimes outdoors in a crowded setting. And we just hope people won't forget that, no matter what their inhibitions may or may not be, because of being able to be on a patio again, because it's really just in the interest of continuous to move us forward, as opposed to having to throttle back at some point in time, which I think most people would deeply regret, including all of us. But it's one of those kinds of things where you just want to avoid that at all costs, and it's just fairly straightforward adherence to the same rules people have been adhering to so well for the last number of weeks and months.
Also, you've spent a number of weeks now preparing businesses, telling them to get prepared, know the rules. There still seems to be some confusion among some of the businesses that we've spoken to about how exactly they're supposed to go about doing this, although everyone seems to have the best intentions. How do you continue to get the message across and make sure that people are doing the right things? Is there going to be any sort of monitoring taking place?
So I'll start off with this and suggest that there are quite comprehensive documents available on our website. They're written in very straightforward language and put together as checklists to try to make it as easy as possible and to make the documents and the guidance as usable as possible for business owners and operators. Certainly, we will continue to try to upgrade advice if people are finding difficulties. They're certainly welcome to call us. We're eager to help our community recover and to launch a successful reopening. But I know that the associations of businesses as well, the various restaurant associations and the like, have also been engaged in this endeavor. There are many sources of support that are out there, but I would turn to our website first. I think our documentation has been put together exactly with business owners and operators in mind, and we're happy to continue to update them with feedback from our business partners and those in the business community.
Okay, thank you. Next question is to Dave Ryder from the Toronto Star. Dave, go ahead, please.
This question could be for both, and that's at the risk of sounding gloomy. I'm just wondering what would happen in order for Toronto to have to consider moving back into stage 1 or imposing further restrictions. In other words, what will you be watching for that could signal potential trouble?
I can make that easy for my part. I would have to hear some advice to that effect from our medical officer of health, whose advice I have accepted as mayor without reservation or hesitation during the entire time of this pandemic. And so on that note, I'll ask her what she would say in response to that question. It's a difficult question.
Well, it may be a difficult question in some respects, but in fact, we've tried to make it as simple as possible and as communicable as possible, or readily communicated, I guess I should say, as possible, by having a monitoring dashboard that talks about the kinds of indicators and the types of progress we want to see in order to ensure that we're making progress on reopening and getting our city back. So certainly we will be looking, and this is in accordance with the provincial framework, we're looking at virus spread and containment. We'd like to make sure that the rates are staying appropriately low and are well contained. We'd also want to see that we have healthcare capacity, that our hospital system and our acute care system is capable of managing surges in COVID-19 cases and at the same time can continue to provide high quality care for non-COVID conditions. Public health capacity is one of the measures that's included in the monitoring dashboard. Certainly we have a key role to play in following up and ensuring controls are in place and that we're doing the best we can to contain virus spread. And of course there's testing. And that continues to be an area that we are watching. Things are progressing there. We know that we've got our percent positivity in respect of tests, as I mentioned in my remarks today, is going down. We'd like to continue to see improvement on the testing turnaround time. That's within the purview of our provincial counterparts. I know that they're working on it. So right now, things are progressing well. We will continue to monitor that, and that will be a foundational part of making a determination as to whether we need to dial back or whether we can continue forward, which I hope we will continue to do.
Thank you. And my follow-up question, I think, is just for Dr. de Villa. After the news conference on Friday, where you talked about the progressively good indicators and the fact that you felt that Toronto was ready for stage 2, on the weekend there was a significant number of deaths added to Toronto's total from investigations that I think were from mid-April to mid-June. Does that change? Do those change Toronto's indicators at all? In other words, do they add to our COVID case count or add to our deaths or cause you any concern at all?
No, so that doesn't actually change anything with respect to our understanding of the monitoring dashboard. It often takes some time to clean up the data, particularly when you're managing a sizable outbreak like this one is. So that was more of frankly, a data cleanup and a catch-up in order to make sure that we're reporting appropriately. And other than that, it really doesn't have any impact on the monitoring indicators or our progress per se.
Okay, next question is to Sabrina Jonas from the CBC. Sabrina, go ahead, please.
Hi there. Thanks so much for taking my question. Mayor Tory, you mentioned deploying more bylaw officers to the beaches. Is it safe to assume we can expect then to see more bylaw officers in action on beaches next weekend? And does that mean there could be more tickets for people who are not physical distancing on the beach?
Well, the bylaw officers are there, as we've said all the way along, to educate, but obviously it's in their purview if they wish to do so, not on instruction from politicians or even other public servants, to write tickets if they feel that's appropriate. That'll be up to them. But I think in the end, we recognize the fact, and I think most people would too, that the notion of somehow policing every single inch of beach when we have miles upon kilometer of beaches in Toronto is just not going to be possible. We don't have enough people to do that, and some would even question whether you allocate resources to do that. So again, it comes back to people having a good time and enjoying the beaches, which we very much want them to do on this short summer season that we have, but at the same time, exercising responsible behavior, because the other thing you can't do on the beaches is draw circles there. So hopefully people can draw their own circles and can draw their own conclusions as to what the right thing to do is, and we're counting on them doing that, and on these kinds of beach parties with all the litter and whatnot being something that we just don't see repeated.
Follow-up, Sabrina?
No follow-up. Thanks so much.
Okay, thank you. We'll go next to Beth McDonnell from CTV News. Go ahead, Beth.
Hi, my first question is for the mayor. Mayor, you talked about the budgets and service cuts. What types of cuts are you imagining or thinking at this point, given the economic situation?
Well, we haven't begun in the City of Toronto's case. There are other municipalities that have a different budget cycle than we do. We have drawn up a list which I shared with the public some time ago, and this was not a list that was meant to scare people. It was a list of the honest, realistic, no-holds-barred kinds of cuts we'd have to make, like cutting the transit service in half, like substantially reducing the support we're able to give to childcare and to homelessness. These are just the realities of what our budget pays for now. And so in our case, we haven't begun the task of actually starting to refine that list for 2020 if we had to implement it or not. In the case of other cities, they are on a different cycle than we are, so that's why I said these meetings would start in the GTA this week coming, and you'll actually see some discussion of these things happening, and that's why it's urgent before Toronto ever gets to that point, which isn't that far away, that we get some help from the other governments. And I know they're working on it. I know Premier Ford is trying to be a helpful leader in that regard, and I commend him for that. But the bottom line is that time is marching on, and the situation is becoming more urgent as each day passes. And so we're getting to the point where some decisions are going to have to be made soon, and it will start this week in some places, or they'll start the decision-making process.
Great, thank you. And Dr. de Villa, you talked about watching for flare-ups. What does that mean exactly? And how do people respond?
So we know through the experiences of other jurisdictions, and it's not unexpected here either, that as more people start to move out and about, as we move towards reopening, it means that there's greater opportunity for people to mix and interact with each other. And because we're talking about a respiratory virus that is transmitted from person to person, primarily from person to person through their respiratory droplets, when they talk or cough or sneeze, we know that as we reopen, you can expect that there is increased risk and therefore the potential for more COVID-19 cases to come up. So that's what we're talking about when we're talking about a flare-up in new cases. And that's why it's important as we move forward that we're constantly monitoring what's happening and that we're certain that we have the necessary resources in place to manage those increases in case activity as they arise. So we want to make sure that there's hospital capacity to treat people should there be people who have severe enough COVID-19 infections that they need to go to hospital. We want to make sure that there's public health capacity to manage that, to manage those cases and to follow up on cases and their contacts. That's the kind of preparation that we're talking about. But importantly for the public, what that means is continuing to follow that public health advice we've been providing for several weeks now. Stay home if you're sick. Maintain your physical distance, at least 6 feet from those who are outside of your household or social circle. And please, wash your hands regularly. If you don't have access to soap and water, use an alcohol-based hand sanitizer. And of course, use a cloth mask when you are in an indoor public space in order to protect others from your germs.
Okay, thank you. We'll go next to Phil Martino from 680 News. Phil, go ahead, please.
Thank you. My question is for Dr. de Villa. The medical officer of health in Wellington, Dufferin, Guelph has issued an order making masks mandatory in commercial establishments. Now, with Toronto entering stage 2, are you considering doing the same? And if not, what is the reason?
So what we're doing here now is, as you say, we're moving to stage 2, and we have consulted with our legal counsel around masks and what we might be able to do. And the current advice that I have received in respect of issuing or making masks mandatory is that that's not really within the power. However, my message is very, very clear with respect to masks. My recommendation, strong recommendation to the public, is to wear a cloth mask when you are inside a public space, an indoors enclosed public space. So this would include things like stores or pharmacies or public transit. And the reason why I'm making that recommendation is not to protect oneself from others, but to protect others from your germs. This is the best thing that we can do within those enclosed indoor spaces. Of course, there is other advice, as I've been speaking about now for several weeks: washing your hands, staying home when you're sick, and maintaining physical distancing wherever possible. But the very simple and short message when it comes to the use of masks is to please wear a cloth mask when you are in an indoor public space in order to protect those around you from your germs.
Follow-up, Phil?
Thank you, Dr. de Villa. Yep, that's it. Thank you.
Okay, thank you. Final question now to Francine Copin from the Toronto Star. Go ahead, Francine.
Hi, my question is about the Toronto Islands. I'm wondering why they haven't reopened yet. Is it because you don't want people, on ferries close together? What is the reason for the Toronto Islands remaining closed, and when can we see them reopen? Because of course they're an important part of summer for a lot of people in Toronto.
I think the answer as to a reopening of the islands is soon. There is no question but that the regulations which apply as of the moment to the ferries, which limit them to half capacity, is a very big constraining factor, only because if you can imagine when we have lineups when the ferries are operating at full capacity, what kind of lineups you might have when they're restricted by federal regulation to half capacity. And there's a number of other factors, such as the fact that, for example, the provincial orders, I believe in stage 2, still would not permit for the reopening of some of the amenities over on the island. So it's been a complicated set of circumstances that have led us to have the island remain closed for the time being for all of those reasons. But I think you will find there will be a partial reopening in the not too distant future, recognizing the fact that it's a very sought after place for a lot of people to be during the summer months, and we think we can fashion a plan that takes account of all of the different restrictions and things that may not open as soon, and get people back over there enjoying the Toronto Islands.
So a follow-up question to that. Are people allowed to go to other areas of the Toronto Island other than, the public park area, or is it off limits to anybody except residents?
I believe I'm correct. Well, actually, maybe Janie could answer, then I won't have
Sure.
to say I believe I'm correct. She can actually answer this question.
Janie, can you address that, please? Janie Romoff on the line? Janie, can you hear us? Well, I can help with.
I was going to say, subject to being. Well, you go ahead.
Well, I can answer that while we try to get Janie. The island is a park, and it does remain open. It's the transportation to the park, to the islands itself, Francine, that is restricted right now. Residents who live on Ward's Island are able to commute, obviously, back and forth, and so that ferry service has continued to be provided to them. It's the transportation to the island that's currently not available.
And I think all I was going to say as well, Brad, I believe it's true to say that people could get on, including residents, on that ferry, the one that's continued to operate, and find their way to the public park.
Yes.
In the meantime, it's just that the park, things like the washrooms have not been open, the ferry service has not been operating, some of the other amenities are not open, some won't open, so that's why it's been deemed best overall to keep the park closed. But people could get there, theoretically, under the current arrangements.
It's Janie. Sorry, I had a connection problem.
Okay,
Can
go
people
ahead,
hear me
Janie,
now?
please. Thank you.
You can correct all of our answers.
Everything that you've all said is 100% correct.
Fantastic.
The Toronto Island Park has not been closed, and there has been some access through, the small ferry that has been operating under the Transport Canada guidelines. And Mr. Mayor, you're correct. We are in the process of looking at a partial reopening, as well as opening some of the important amenities on the island that support a broader use of the park, including washrooms and other public amenities that are required. So more to come on that shortly.
Thank you very much, Janie. Thank you, Francine. Thank you all for joining us. That concludes today's briefing. We'll be back here again Wednesday at 3:45 p.m.